We know there is a worldwide mental health epidemic that has clearly worsened in the 21st century due to a range of health and environmental stressors. Schools are bursting at the seams with youth who are showing more mental health problems at a younger age. This burden of providing mental health treatment is falling to schools. School staff are on the front line, delivering up to 80% of youth mental health services due to their regular contact with students, as well as parent difficulties accessing and affording outpatient treatment for their children. There are rising demands for school counseling, an increase in special education referrals, and an increase in school refusal behaviors. Such demand is having a serious impact upon teachers and school administrators, with many reporting chronic stress, poor performance, and even burnout. The stress for staff and students isn't going to disappear on its own. We need to equip school staff and students with tools much earlier if we're going to change and save lives, keep students in school, and ultimately effectively launch these students after high school. Those of us in the field have a responsibility to try to make a change, to give school staff evidence-based interventions for their students. Based on demand, we at Cognitive and Behavioral Consultants have formulated a school-based DBT program. What is standard DBT? Dialectical Behavior Therapy for adolescents is an evidence-based psychotherapy developed by Miller, Rathis, and Linehan to treat youth presenting with emotional and behavioral challenges, including self-harm. We adapted DBT for schools, including individual DBT counseling, weekly DBT group or classroom skills training, skills coaching as needed during the school day, and DBT provider consultation meetings. DBT balances acceptance and change, validating students' current emotions while helping them better manage their behaviors in order to help them reach their goals. This cultivates a more validating environment within the school community of teachers, coaches, administrators, and students, as well as within families. Our program incorporates a biosocial approach, teaching students new skills to regulate emotions, while also creating a more validating school environment that is non-judgmental, more accepting, and warm. When students feel validated, they feel better understood and accepted, more connected and content. This helps them regulate emotions, improve focus and academic performance, become less impulsive, and have better interpersonal relations, ultimately empowering them to make more positive life changes. DBT teaches valuable life skills not only to students with greater social-emotional challenges, considered Tier 2 or Tier 3, but also to more emotionally resilient students in general education considered Tier 1. Tier 1 students can receive DBT universally in the classroom with our DBT Steps-A curriculum written for teachers, co-authored with Jim and Liz Mazza. Another advantage of our DBT programs is that they can impact and improve the quality of life for school staff. They too learn how to regulate their emotions, be more mindful, and cope with stress. Our DBT program originates from clinical research amongst depressed and suicidal Black and Latinx adolescents in the Bronx, New York. Results showed DBT to be a promising approach for treating youth at high risk. We apply DBT's 5 skills modules for schools that both students and school personnel can learn and apply. Mindfulness to improve students' mental focus and self-awareness, distress tolerance to reduce impulsivity or avoidance, emotion regulation to improve students' abilities to control their emotions, interpersonal effectiveness to improve students' abilities to build or maintain relationships, get what they want from others, and keep their self-respect. Walking the middle path to help students, teachers, and parents improve dialectical thinking and better validate themselves and others. All of these skills modules work beautifully when put together. The comprehensive school-based DBT program was launched in 2007 and has been successfully adopted by over 100 schools across the United States. We continue to monitor its effectiveness with positive preliminary results in terms of students' improved emotional, behavioral, social, and academic functioning, as well as improvements in school culture and staff burnout. For more information, please contact us.